with the PD classes, I'm feeling very confident, sir. First of all, I thought that I can't, matlab ki I would be blank in front of the panel, but now I have that confidence that I can speak at least. I tried to explain myself in front of panel, sir, because of this confidence.
On 7th of December, certain questions were asked by Armed Medical Corps. I want to ask these questions from you. When you were joining PD classes, you were not having complete 7 days. So at that time, what dilemma was in your brain, and now how are you feeling within 3 days of
Yes, sir. Dilemma at that time, like, should I complete this in these days, because I don't have lots of days.
Right.
I am not confident enough that I can speak to the person, because when I first time tried the first answer introduction which I made for myself, and I tried to speak in front of my friends, it's like and I'm totally blank in front of them also. So I thought, even if I can blank in my friends in my group, I can completely blank in front of the panel, sir. So it make me confident, and I know that I can at least speak something about myself and I can answer.
Tell me about your achievements of life.
Sir, my achievements of life is I have attended so many medical camps during flood in Kolhapur in 2019. I also have attended so many camps arranged by foundation, many foundations in Kolhapur during flood period, and also in other times, which provide a rural health checkup to the rural people belong to the rural area. Yes, sir. During my internship period, I also have handled various emergency cases. During my internship, I have posted in a various departments like medicine, surgery, gynec, pediatric, and emergency medicine. And I learned there how to manage emergency cases, sir.
On 7th of December, certain questions were asked by Armed Medical Corps. I want to ask these questions from you. Tell me about heat stroke.
Heat stroke. Okay, heat stroke is a condition when person exposed to lot of temperature, sir. When a person is doing strenuous activity during under a high temperature, then person feels a dehydration. Due to of dehydration, the water get lost and circulatory volume goes down. Because of that, patient feel syncope-like symptoms and can fall down. The main management for this treatment is rehydration, sir. Rehydrating the IV fluids.
Tell about gallstone.
Gallstones. Okay, gallstones are the stones which are formed in a gallbladder. Main function of gallbladder is to sorry, sir, I have to read upon this. Sir, voice, audio, sir.
Tell me about anal fissure.
Anal fissure. Okay, sir. Anal fissure. The main symptom of anal fissure is a bleeding during defecating. The patient comes with the complaint of bleeding during defecation or a pan full of blood, fresh blood. The main management for this anal fissure is antibiotics prophylactically, mainly metronidazole, and supportive management as an analgesic. Yes, sir.
Tell about DVT.
DVT is a deep venous thrombosis, sir. Deep venous thrombosis is the condition when patient face the hypercoagulative state, in which the deep vein system of the legs venous thrombus is formed. The main complication of deep venous thrombosis is when it gets dislodged and stuck in a pulmonary circulation, which causes pulmonary embolism. Patient sudden present with the sudden breathlessness and decreased saturation, sir. Symptoms of DVT are also pain during walking. That's called claudication, sir.
Okay. Tell about peritoneous heat injury.
Peritoneous heat injury. Sir, I have to read upon this, sir.
Okay. Tell about chest trauma.
Okay, sir. Chest trauma is a condition when a person facing a blunt chest trauma or a penetration trauma. Blunt chest trauma can cause injury to the ribs, heart, and lungs, sir. During the blunt chest trauma, when heart gets hematomized, it can cause a sudden death. And blunt chest trauma can cause pneumothorax, which causes injury to the lungs and escapes the air into the pleural cavity. The patient's complaint comes with the complaint of breathlessness, which increases its severity during a time period. The best management for a pneumothorax is emergency needle thoracocentesis, which is done in a fifth intercostal space in a mid-clavicular line, sir. And the definitive management is tube drainage, sir.
Okay. Tell about fistula.
Fistula. Fistula is same as a anal fissure, sir, which also called as hemorrhoids. The main symptoms are same, that is bleeding during defecation or bleeding just after completing the defecation. Patients come with the complaint of the toilet pan full of the fresh blood, that is called hematochezia, sir. The main management is antibiotic, analgesic, and patient also treated for anemia, sir. If the fissure is of severe is of the large size, then main definitive management is surgery, sir.
Okay. Tell about types of MI.
Types of MI, myocardial infarction are mostly stable MI and unstable MI. In the stable MI, the coronary artery, the most common cause of myocardial infarction is a coronary artery disease, sir. When coronary artery disease gets thrombolized during a long period of time, it causes narrowing of the lumen for a long period, which leads to which helps to form the collaterals. So the only symptoms of stable angina is when patient do a heavy exercise, and patient comes with the complaint of chest pain and dyspnea only during a heavy exercise. And unstable angina is a condition, sir, where a thrombus get enclosed in a coronary artery, which causes sudden sudden decrease of blood flow to the myocardium, which causes sudden chest pain, which is sudden with more severity, sir. The main management is providing oxygen, morphine, and if thrombus is present, thrombolysis can be done, sir.
Tell about USG abdomen.
Okay, sir. USG abdomen is a primary investigation of choice when patient come with the complaints of abdominal pain, sir. By doing USG, we can observe internal organs such as appendix, pancreas, abdominal wall, any swelling of abdominal wall, liver, spleen, all can be visualized, sir. If there is any pus collection, or any collection is present in abdominal cavity, it can be seen by sonography, sir.
Okay. Tell about shock.
Okay, sir. Shock. Shock is a type of circulatory failure, sir. Shock can be hypovolemic shock, septic shock, neurological shock, and also okay, these types are the shocks, sir. During hypovolemic shock, when the circulating blood volume decreases, it's lead to cause a shock, which causes decrease in a cardiac output and decreased blood supply to the all of the organ. In the neurological shock, sir, when a person get injury of the brain, it causes bradycardia, which it activates, it loses sympathetic system, which causes bradycardia, and also the hypotension, sir.
Okay.
Yes, sir.
Whatever questions I'm asking you, they all are on the same 7th of December. And
Okay.
different doctors' views, even our students' views. But they ask you first, what is your favorite subject? So that also depends.
Okay.
Suppose you tell surgery, then they'll go on the topics different related to surgery. And if you tell about medicine, okay, you tell me next question. Differential diagnosis of acute chest pain.
Okay, sir.
The question
Differential
of 7
diagnosis
from board 1.
Okay, sir. Differential diagnosis of chest pain can be related to lungs and also can related to the heart, sir. Uh, chest pain with the heart can come with the various situations such as sudden attack, sudden emergencies, which may be due to valvular disease of the heart, and also the pleura, also associated with the pleura of the heart. When pleura of the heart get infected, it is called pleuritis. Sorry, it is called carditis, sir. The muscles of heart get infected. It is called carditis. It also causes pain. And during decrease in blood supply to the cardiac muscles, it also causes pain, which is called as myocardial type of chest pain, sir. Uh, Causes related to lungs are mainly associated with decrease in the movement of lungs, which causes decreased circulatory oxygen to the organs. The main cause for this is can be a pneumothorax. Because of pneumothorax, cavities accumulated by the air. Other cause can be a hemothorax because of that cavity, lungs cavity is accumulated by the blood, sir. It causes lungs to decrease its function and it causes pain during inspiration and expiration, sir. During the during the rib fracture or any blunt trauma to the chest can causes inflammation of the lungs nerves, intercostal nerves, which also causes the chest pain, sir.
Okay, management of MI. This question was also asked.
Okay, sir. Management of MI. Main management is oxygen, sir, to maintain the saturation of oxygen, to maintain the saturation of the patient. The second drug we can be used is a morphine, sir, which decreases the pain and also decreases the preload of the patient, which causes increase in a circulatory volume, sir. The next third drug which can be used is a sublingual trinitroglyceride, sir, which causes dilatation of the coronary arteries, which provide adequate amount of oxygen required for action of myocardium. The next can be anticoagulant, sir. Anticoagulant can be used to decrease the progression of thrombus formation. The next can be aspirin. Aspirin is immediately used as a 300 mg dose, sir.
Okay. Now tell me the fractures leading to hypovolemic shock.
Okay, the main fractures which are leading to hypovolemic shock are mainly associated with the long bone fracture, usually associated with the pelvic bone or the femur fracture, which causes increase in a internal blood loss. So the patient can undergo in a hypovolemic shock, sir.
Remittent fever.
Remittent fever. Okay, it is a type of fever, sir, which increases and decreases. But when it decreases, it touches its baseline and it increases after some time, sir. Also.
Okay. Tell about urine, RE, and ME.
Okay, routine microscopy and routine investigation. Okay, sir. In a urine routine investigation, we generally see for the color, the content of the urine, that is urine is clear or turbid. Depending upon color, it is pale yellow, dark yellow, or containing with any hemorrhagic fluid. And also in a routine investigation, we check for a presence of WBC, RBCs in a urine content, or any pus cell, epithelial cell, which can be found in a urine, sir. And in microscopy, sir, we can see the RBC and WBC. And for culture, we culture the urine for any growth of microorganisms.
Okay. Tell me about common ear infections.
Okay.
Question on 6.
Common ear. Okay, common ear infection. I have to read upon this, sir. Matlab, I know, but I can't explain it right now.
Right. What is about NCD diseases?
NCD?
Yes.
Okay, NCD are non-communicable diseases, sir. Mainly non-communicable diseases are hypertension, diabetes. Non-communicable diseases are those which are only related to the person's body. It cannot be infected to the others. The main is hypertension and the second main is diabetes, sir.
Okay. Tell me the management of hypoglycemia.
Okay, hypoglycemia is a condition in which the blood sugar decreases to less than 70 mg per dl, which causes it is the value for the normal people, but for the diabetic people, when the hypoglycemia is called when blood glucose volume decreases to 54 microgram per dl, sir. The common symptoms which are associated with the hypoglycemia are palpitation, tremor, diaphoresis. Yes, sir, can be sometimes associated with the syncope.
How are you feeling with PD classes now?
With the PD classes, I'm feeling very confident, sir. First of all, I thought that I can't, matlab ki I would be blank in front of the panel, but now I have that confidence that I can speak at least. I tried to explain myself in front of panel, sir, because of this confidence.
Okay. Okay, tell me about pediatric vaccine schedule.
Okay, sir. Pediatric vaccine schedule is mainly known as national immunization schedule to keep the child vaccinated for the diseases which can be avoided with the vaccine. The vaccine which are given at the time of birth are BCG, hepatitis B, and the OPV, oral polio virus. At the 6th, 10th, and 14 weeks of age, the vaccines are given as a pentavalent 1, pentavalent 2, and pentavalent 3, respectively, and OPV1, OPV2, OPV3, respectively. And also, sir, IPV vaccines are given at 6 weeks and at 14 weeks. And pneumococcal vaccine are also given at the 6 weeks and 14 weeks. Yes, sir. At 9 months, measles vaccine is given, and along with the measles vaccines, vitamin A vaccine is given. Yes, sir. And at 15 to 16 weeks, DPT booster is given, and TT injection TT is given. Vitamin A vaccine is given from 9th month. Then second dose is given at 1 year after that, and then every 6 months, sir. Okay, and at the 5-year OPV can be given, not OPV. At 5-year, TT vaccine can be given, sir.
So can you tell me about mountain sickness?
Okay, mountain sickness is the condition when the persons climb up above the sea level, which causes the person who are actually residing in that level are get some changes in the body when another person who reaches to that height suddenly, whose body is not preparing for that decrease in oxygen level. At the mountain level, the oxygen level at that point is decreases in atmosphere. Atmospheric pressure of oxygen is less. Therefore, body can't handle that decrease in oxygen level. Patient usually present with the breathlessness, nausea, and vomiting, and loss of consciousness, sir. The early management for this situation is matlab take that person to the less height so that body can get adjusted with that temperature, sir. Decrease in oxygen at a highest level can causes pulmonary edema, sir, and also the cerebral edema. The main treatment for this situation is get the person to the lowest height and oxygen supplementation, sir.
Okay, tell about palpable artery in human body and sites.
Okay, the most common palpable artery is the radial artery, sir, which is commonly palpated against the radial bone in a wrist. Second palpable artery is the brachial artery, sir, which is palpated at the elbow joint, medial side. Third palpable artery is a femoral artery, which can be palpated in a inguinal region. Not inguinal region, at the which is palpated near the inguinal region, sir. Fourth palpable artery is the dorsalis pedis artery, which can be palpated on a dorsal aspect of foot, sir. And fifth palpable artery is the facial artery, which can be palpated against maxilla bone, sir.
Tell about petrol consumption management.
Okay, sir. Petrol consumption is a hydrocarbon poisoning, sir. there is no definite antidote for the petrol poisoning. The first step which can be taken in a petrol poisoning is a decontamination, which causes removal of the contaminated clothes or wash the body part which are contaminated with the petrol and provide the oxygen to the patient. Gastric lavage is contraindicated in a petrol poisoning, sir. Petrol poisoning affects the central nervous system, respiratory system, skin, and eyes, sir. If it get exposed to the eye, clears the eyes with the clean water. Skin contamination can be cleaned with the plain water wash. For the central nervous system, it affects the patient's central nervous system by causing decrease in a depressing the respiratory center. If the sign and symptoms of decreased respiratory symptoms are seen, then intubate the patient. Yes, sir. And look for any chemical peritonitis, or if there is aspiration, then chemical pneumonitis, sir. And
Tell
treatment
about
accordingly.
decompression syndrome.
Okay. Decompression syndrome is the condition when the persons get deep into the sea or deep into the water. At that moment, sir, there is a oxygen is present in a hyperbaric form. More pressure is present in oxygen, which causes decompression syndrome. Air bubble can be present in a cavity, sir. The main management is bring that patient to the surface level, sir. And oxygen
What
supply.
is Nik Portal?
Sorry, sir.
Nik Portal.
Okay, Nik Portal is related to TB, sir. It's the digitalization of the TB drugs, which monitor the patient compliance. That patient has taken any medicine or not. If the patient is not have taken medicine, then it buzzes. It makes a sound. It important to know the patient that he misses the tablet for that day, and it also gets to know that for the corporation that the particular person is missing his today's tablet.
Okay. Okay, ICD, triangle of safety.
Okay. For ICD tube insertion, triangle of safety is usually in the axilla, which is anterior border is its border is anterior axillary fold, posterior border is a posterior axillary fold, apex is in a axilla, and base is formed by the fifth intercostal space.
Okay. What is the difference between disinfectant and sanitation?
Disinfection, grossly I can say disinfection is the condition where we purifies the substance or water which is already contaminated. And sanitation is the it's the procedure which we taken as a prevention, sir.
Prevention. Okay.
Sir.
Okay. Tell about asthma management.
Okay. Asthma management can be depend on a condition of the patient. Like patient is an intermittent case of asthma, not requiring regular doses. Then the patient can it's also called the seasonal asthma. When the patient requires asthma management only during certain season, like in the winters or during a rainy climate, then the patient can have a long-acting beta-2 agonist and inhale corticosteroids, sir. It's sufficient for that patient only during that season. When the patient is the mild patient, having mild symptoms, then regular dose of inhale corticosteroids and beta-2 agonists are required for that patient. And when the patient having a severe asthma, that is during all the day and all the seasons, patient is having a symptoms of asthma, then patient should be on a regular dose of long-acting beta-2 agonist, inhale corticosteroids, and also short-acting beta-2 agonists, bronchodilators.
Mostly AMC people are asking about chloroquine doses or malarial treatment. A question asked by AMC, malarial control and eradication.
Okay. Malarial control and eradication is mainly focused on the mosquito control, sir, because malaria is only spread by the mosquito. Mosquito control is the almost prevention and also the treatment to control the malaria. The main management can be DDT, DDT. Malathion spray can be used. The other prevention can be used are mosquito nets. Other are can be a mosquito repellent spray, mosquito repellent cream. Yes, sir.
Do you know one country where there is no mosquito at all?
No, sir.
France. No single mosquito.
Achha.
Okay, tell me about your hobbies.
Okay, my hobbies are dancing, singing, interacting with the new person, and traveling, sir.
Okay. And when you were joining PD classes, you were not having complete 7 days. So at that time, what dilemma
Yes,
was
sir.
in your brain, and now how are you feeling within 3 days or 4 days?
Yes, sir. Dilemma at that time, like, should I complete this in my these days, because I don't have lots
7
of
days,
days.
right?
I am not confident enough that I can speak to the person, because when I first time tried the first answer introduction which I made for myself, and I tried to speak in front of my friends. It's like and I'm totally blank in front of them also. So I thought, even if I can blank in my friends in my group, I can completely blank in front of the panel, sir. So it make me confident. I know that I can at least speak something about myself, and I can answer some questions.
Wonderful. Okay,
The
come on
concept
video call.
is the confidence which built by PD classes, sir.
Thank you. Come on video call. We'll have our later portion of body language, which is remaining. Okay.
Yes, sir.